Hello, coders. Good morning, good evening, good afternoon, all. Depending upon where you're joining us from, welcome you all to another session of CPT Guideline Mastery here at AMCI. How are you all doing, coders? Let me quickly look into the chat. Thank you, Miss Mills, for letting me know. And Miss Mills, I just want to let you also know that I am unable to put I'm unable to my comment section is not working properly. So if it would be possible for you to place the survey link towards the end of the session, that would be great. Okay. Who else are there with us today? Hi, Miss Catherine. Welcome. Okay. Yes, Miss Euphemia. The playback will be available. I was trying to reply back to you, but unfortunately, due to some technical issues, I was not able to put the reply comment in the comment section. So, yes, the playback will be available. Okay. Hi, Nina. Who else are there? Hi, Sapphire. Hi, Andrea. Okay, hello, Starry Sunny. Welcome. Okay, coders. So I don't want to waste much time. So we have a good topic to discuss here at AMCR. We are at week 6. And are there any AMCI students, MCDC students in the chat joining with us? You can let us know which topic we are going to review today. Okay, let us know in the chat. So before that, let me read out the copyright. CPT copyright 2026 American Medical Association, all rights reserved. CPC is a registered trademark of AAPC. The AAPC content found within this presentation is a copyright of AAPC. Keyword concept FTR Chun AMCI FAB 7 AMCI ICD 10 Flip, Tap, and MCG are the trademark of AMCI. The credentials CPC, CRC, COC, CP, MA, CPB, CPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. The credentials CCA, CCS, CCSP, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. Okay, I can see a few more coders joining with us. Hi, Jess Christy. Hi, Baker. Okay, hi, Christina. Hi, Becky. Welcome, everyone. All right, so thank you, Miss Mills. Miss Mills have already placed a survey link in the chat, coder. So that's what I'm going to talk about next. So I can see there are already 30 plus people, coders joining with us for this session. Last week, I only received 5 survey feedback or survey submission. So I kindly request you all to take a moment once the session is over to fill out that survey form. We'll be placing that towards the end as well. Okay, please let us know how you feel about these sessions. Your feedback is always important, incredibly important to us, and we do listen to what you have to say as well. So if you have any topics in mind, next week it will be pathology and medicine chapter. So if you want us to review any of the topics from the pathology and the medicine chapter, which we haven't reviewed yet, please let us know in the survey link as well. Okay, so it will just take less than a minute. So please make sure you fill out that form towards the end of the session. Okay. And the topic for today, we are going to review the radiology coding. Yes, at week 6 here at AMCI, we'll be reviewing the radiology and anesthesia. So today I thought let's take the radiology chapter and let's go through them. So before I begin, I want to tell that I will be not focusing on the modifiers in the radiology, the 26, the professional and the technical modifiers on this session. Okay, because we already had a fantastic session on modifiers by Mrs. J. That was a 4-week session. So please do feel free to go and watch those playbacks. I believe that playbacks are already available in MCI channel. So please do take a time to review your modifier knowledge, especially on the radiology, because radiology, the 26 modifier and technical component modifier is really important, and that's really tested for your board exams as well. I will be reviewing them maybe on the next semester for the time being. So you all have a great video, great source to refer to. So please take a moment and you can review them whenever you are free. Okay. And today we are going to look into something else. Uh, Mainly, we will be focusing on other topics which we have in or we are not used to. We never covered these topics like the diagnostic ultrasounds. And today we will be also reviewing some of the guidelines and do some exercises on diagnostic radiology. We already completed the radio oncology. That was good sessions, and the again playbacks are available. You can review them there as well. So these are the topics which we will be covering. Mainly, we will focus we'll go hard on the diagnostic ultrasound. Okay, so before we begin, let's review few of the general guidelines. Okay, let's begin with the administration of contrast material. So what is a contrast, or what actually with contrast mean? So in the imaging codes, which you will find in your radiology section, with contrast does not mean that patient receive contrast by any route. For coding purpose, contrast must be administered in one of these three specific ways. And first one is your, there you go, first one is your intravascular. This means contrast is injected into the blood vessel, usually through an IV. Okay, and we commonly see them for your CT scan, MRI scan, etc. So that's one route, the intravascular. Okay, the next one is intra-articular. As the name suggests, this means contrast is injected into the joint space like shoulder, hip, knee, etc. And then we have the third type of route, or third administration type, which is intrathecal contrast. And this means contrast is injected into the spinal canal or cerebrospinal fluid space. And it is mainly used for the certain type of spine imaging procedure. So these three are the main routes of contrast administration, which we consider as with contrast in radiology codes. Now, the most important coding point that you might miss out sometimes. The key coding part is that oral or rectal contrast alone is not coded as with contrast. So, for example, let's say a patient drink contrast before the CT scan. So, even though the contrast was given, the examination will be still coded as without contrast because the route of administration is oral. Okay, so oral and rectal contrast are not coded as with contrast study. Make a note, coders don't miss that one. That's very, very important. Okay, now let's look into another important radiology concept or guideline, that is regarding the supervision and interpretation and image guidance. So, imaging often used during the surgical or medical procedures, right? And it may help the provider to actually locate the correct area, guide a needle, as well as confirm the placement or interpret what's happening during the procedure. So, here the first question you should ask is that, is the image guidance already included in the main procedure or not? Because many CPT procedure codes actually includes image guidance, the term image guidance. So when the code description, okay, so when the code description means or says that with the image guidance is included, in such cases, you must not bill or you must not code the image guidance from the radiology section separately. Okay, you will not code them, you will only code the base code. And when the image or imaging language is not included, in those situations, appropriate image guidance as well as the radiological supervision and interpretation code, which is also known as RS and I, can be reported or submitted. All right. So it's as simple as that. When the code language includes the image guidance or supervision and interpretation language, you will not assign separate code from the radiology section. If it's not there, you can. Okay. There you go. Yes, and there are some requirements for building or coding these supervision, interpretation, as well as image guidance CPT codes. For the image guidance, patient record must contain number one, a permanent recorded images. Okay, and number two is that a description of image guidance in the procedure report. So these are the two requirements for the image guidance, to build the image guidance code. And for the radiological supervision and interpretation, number one, you require a permanently recorded image. Number two, procedure report or separate imaging report must be there. Number three, a written interpretation of the findings must be there. Number four, a documentation of radiological supervision must be there as well. So these are the requirements for coding a radiological supervision and interpretation, as well as image guidance codes from the radiology section. Okay, now let's turn our attention. Let's quickly review most common type of radiology imaging procedures that you will find in the radiology CPT section. So first we have the X-ray imaging. So most of you must have seen a X-ray film, right? So X-ray uses small amount of radiation to create images of the bones and some body structures. So they are commonly used to identify the fractures, chest conditions, and joint problems. So mostly if we go to an orthopedic physician with the fracture or something like that, they will first thing they do is to take a X-ray. And next we have a CT or computed tomography. So this CT scanner takes multiple X-ray images from different angles and combine them to create a detailed cross-sectional image. So you can think of it as viewing body in slices. So this is the image of a CT machine. All right. And then we have MRI or magnetic resonance image. And MRI it works a little bit different. So MRI uses strong magnetic field and radio waves instead of ionizing radiation. So it is especially useful for detailed imaging of the soft tissue. And from the coding perspective, one thing which I have to say here is that the CT and MRI codes, if you look in your CPT book, you'll find that they are classified into three types. One, CT or MRI done without contrast. Number two, CT or MRI done with contrast. Number three, CT or MRI done without contrast, followed by contrast administration. So we discussed what contrast is, right? So contrast is used to get much more clearer image. So what physicians might do is that sometimes they will do without contrast, that's enough medically necessary, and sometimes they might require contrast image. So they will initially itself they will inject the contrast and take the images. And the third one which I said, so they might require to compare the both image, one image without the contrast administration and one image with contrast administration. So at those purpose or those circumstances, we use a third type, that is the CT or MRI without contrast followed by contrast. Okay, is that clear, coders? Let me know in the chat. Is that concept clear? So that's why you will have three types of codes under the CT and MRA section. Please do let me know in the chat. Okay, and then we have another common type of imaging, which is ultrasound. So ultrasound generally uses the high frequency sound waves to create real time image. So here there is no radiation used, and yeah, there is no radiation. That's why it's most commonly used for pregnancy scans and to look at the soft tissue structures. Okay, and finally fluoroscopy. Fluoroscopy is essentially a real-time X-ray imaging, almost like a live video. So it allows a physician to observe movement and guide the procedures. And there are several other types of imaging as well. So I just thought to show you some example. So these are the few examples of imaging procedures which you will commonly see in the CPT book. Okay, now let's move on to the first major section of the radiology chapter, that is radiology or diagnostic radiology or diagnostic imaging. And one important thing you notice is that CPT codes in this section are mainly organized according to their anatomy. All right, so you can see the procedures or imaging procedures on the head and neck. Then you will have chest, spine and pelvis, upper extremities, lower extremities, abdomen, gastrointestinal, urinary tract, gynecological and obstetrics, heart, vascular procedures, etc. And within these anatomical sections, you will also find many imaging methods as we discussed earlier, like X-ray, CT, MRI, ultrasound, not ultrasound, CT, MRI, etc. Ultrasound, we have a separate section. Okay. And as there are large number of codes in this section, and most of them are relatively straightforward. So rather than reviewing each and every codes individually, I'm going to focus on important coding tips and key points you should keep in mind while remembering or while coding or while selecting the codes from diagnostic radiology section. Okay, so let's move on and let's look at coding X-rays. So while coding X-ray, one important concept you need to understand is the X-ray projection. So what is an X-ray projection? An X-ray projection tells us the direction X-ray beams travel through the patient before it reach the image receptor. So for example, I have AP, or otherwise known as anterior posterior projection. Now here what happens is that the beam will enter from the through the front of the patient and exit through the back. So you can see over here, this is the machine through which the radiation will come. So the radiation will enter through patient's front and exit through back. So this is known as anterior posterior projection, or the X-ray film will be, or the end result will be anterior posterior view. Okay, next example. This is PA view or PA projection, otherwise known as posterior anterior projection. Here, the beam enters through the back and exit through the front. You can see how the radiations are traveling, right? The machine, the X-ray emitting machine is located at the back. It will enter through the back and exit through the front. So you, if you have taken sometime in your lifetime, if you're taken the chest X-ray, you would know what a posterior anterior view is. And next example, we have lateral projection. So here the beam travels from one side of the body to the other side. Okay, and this will help the radiologist to determine whether the abnormality is located the front or the back of the body. So these are just few examples of the different type of projection. And the reason why I showed this is that from the coding perspective, the key point is to count the actual number of views performed. All right. So your X-ray codes are based on number of views that will be performed. So don't worry, let's do an exercise and you will get much more better idea of what I'm talking about. Here we go. Here is your example. Which CPT code should be reported? Options are option A 71045, option B 71046, option C 71047, option D 71048. A patient presents with persistent cough and chest discomfort. Physician orders chest radiological examination consisting of following views: 1. PA view, 2. Lateral view, 3. Anterior oblique, right anterior oblique view. Radiologist performs and interprets all the three views. What CPT code should be reported? So, coders, you can type the answers in the chat. Okay, I will wait for some time, maybe around 10-15 seconds. You can place the answers in the chat. All right, anyone else to place the answer? Give your best shot, coders. Don't worry even if you get it wrong. Yes, you're right. Place your best answers in the chat. That's what Miss Catherine has been saying. Okay, I will wait for 5 more seconds. Give your best shot. Don't worry, your CPT codes are there in the screen. All you have to do is pick the correct one. All right, so let's look into the code option. We have A, B, C, and D. They are 71045. We have 71046, 47, and 48. So all are coding for radiological examination or radiologic examination of the chest. So first one, 71045, is for single view. 71046 is for two views, 71047 is for three views, and 71048 is for four views. So how many views was performed in our scenario? So we had first PA view, that would be considered as one view. Then we have lateral, that's another one, so two views. Then we have right anterior oblique view. So totally we have three views of chest performed, right? Are you following, coders? That means the correct CPT code would be 71047, which is option C. And I see only option C in the chat. Fantastic. C4 champion coders. So great job. Yes, 71047 is the right answer. So is that clear how to find the views or how to calculate the views while selecting the codes from the radiology section, the X-ray sections? Okay, I hope the explanation helped. If you have any doubt, you can let us know in the chat as well. Okay, so as I said, we have a lot of codes on those on those section. Let's do some exercise, and that would be much better. So here we have the second question. Which CPT code should be reported? Option A 74150, 72193, option B 74177, option C 74178, option D 74178, 72193 with the 59 modifier. A 45-year-old male patient, male, presents to the emergency department of the hospital with severe acute left flank pain and history of pelvic mass. To evaluate for suspected nephrolithiasis, which is renal stones, physician orders a CT of abdomen without contrast. Additionally, to evaluate the pelvic mass, a CT of the pelvis is performed with IV contrast. Both examinations are completed during the same imaging session, with CPT code should be reported. Okay, coders, you've got 2.5 minutes to answer this. Your timer has started. Okay, all the best. Please, your best answer in the chat. Don't worry, even if you get it wrong, no one is going to judge you here. Okay. Yes, that is right, Miss Mills. Chat is on fire, and you all are doing great job. Excellent. Okay, so let's solve this one. I will walk you through this scenario. In case if you are still working on it, please continue and you can please answers once you are done. So let's look at it. Procedure inventory, we have a CT scan of the abdomen which was done without contrast. And then we had a CT scan of the pelvis which was done with contrast. Okay, so that's what happened here. And these are the CPT codes. We have 74177, which is coding for CT scan of abdomen and pelvis with contrast material. So I think this is not a good code selection because we had a CT scan of abdomen which was done without contrast and was just a pelvis which was done with contrast, right? So 74177 doesn't looks good. And remaining codes, we have 74178, which is coding for CT, tomographic, abdomen, and pelvis without contrast material in one or both body regions, followed by contrast and further sections in one or both body region. Okay, let that code be there. The next CPT code which we have is in option A 74150, which is coding for CT, abdomen, without contrast material. Then we have 72193, which is coding for CT, pelvis with contrast material. Now, this code is also looking a bit interesting, right? We have CT done of the abdomen done without contrast, then we have CT of pelvic also done with contrast. So that's what actually we had in our procedure inventory. But coders, here is a catch. Here is something which you must carefully look while coding the CT of abdomen with pelvis. You have a beautiful table in your CPT manual for selecting these codes. Okay, so you can see what's been written there. For combination of the CT of abdomen with CT of pelvis performed at the same session, use the following table. So when you have CT of abdomen and pelvis done in the same session, you should always come to this table and pick the codes based on this particular table. And how to do that, I'm going to show you. So first thing, you have to look at the left hand side column over here, the standalone codes. Okay, so find out your CPT code from there. So we had CT of abdomen done without contrast, sorry, CT of pelvis done with contrast. These codes are all for pelvis. So we had a CT of pelvis done with contrast, right? So it stands here, and then you will find out the codes for the abdomen. So again, we have a CT of abdomen without contrast. And the point where these two meets, that code is your correct answer. You see how I picked it? So over here we have CT of pelvis with contrast. And if you look up, CT of abdomen without contrast, and the correct CPT code should be 74178. And let's look at the code language for 74178. It is coding for a CT of abdomen and pelvis. Yes, both abdomen pelvis CT was done without contrast material in one or both body region. So in one body region, definitely we didn't had a contrast that was from abdominal region. Then if you read carefully, following or followed by contrast material in one or both body region. Again, we had a CT done in the pelvis with contrast, right? So the best answer and the correct answer for this one is going to be option C, 74178. Okay, let me quickly look into the chat. How are you all doing, coders? Let me know. Let me know in the chat. I see a lot of C, and if anyone got it wrong, let me know. Did the explanation help? And if you had an aha moment, you can Also type in the chat, aha. Okay, great. So, great coding, great coding. Let's move on to the second exercise. Of the following answers, which best describe the procedure? You have option A 74177, option B 74178, option C 74160, 72193, option D 74176. A 52-year-old woman presents to the hospital radiology department for evaluation of suspected pelvic mass. The CT scan of the abdomen and pelvis is performed after contrast material is taken orally. Of the following answers, which best describe the procedure? All right, go does your 2.5 minutes starts now. You can place the answers in the chat. Okay, that is time, and let me look. Okay, we have only few answers compared to the first one. Go ahead, Codes. Go ahead, please. Best answers. Okay, all right. So, what do we have here? We have a CT scan. Once again, we have a CT of abdomen and pelvis done, right? Okay, and these are the CPT codes 74177, which is coding for a CT of abdomen and pelvis with contrast. Okay, and yes, there was a contrast given to the patient. Then we have 74178, which is coding for a CT scan without contrast in one body or one or both body region, followed by contrast and further section in other in one or both body region. So that scenario didn't happen here. That I can say clearly. 74178 is absolutely wrong. We have 74160, which is coding for CT of abdomen with contrast. Again, this is also incorrect. And 72193, which is coding for CT of pelvis with contrast. So option C is also incorrect. Why? Because you saw that we cannot code two codes for CT of abdomen and pelvis. We have a combination codes and we should use that, right? And We have one more code left, that is 74176, which is coding for a CT of abdomen and pelvis without contrast. And you know what code is? If you are looking into the screen right now, you can see what I've highlighted. Yes, the CT scan of abdomen and pelvis was performed after contrast material taken orally. See? So as per the guideline, would you consider a contrast taken orally as with contrast? Let me know in the chat. Remember the guideline which I taught in the beginning, the first slide? Oral and rectal routes of contrast administrations are not considered as with contrast, right? And that's the reason why option, all the other options are wrong, and option C, D is the right answer. 74176. Absolutely. It should be considered as without contrast. CT of abdomen and pelvis without contrast. Right, Kuvam. Okay, coders, how are you all doing? I see a few D's in the chat. Great, great, great job, coders. And let me know, did you had an aha moment or not? Okay, so let's move on to the next topic, next section, and that's about diagnostic ultrasound. So now we are going to look into those ultrasound codes. And as I said, ultrasound or ultrasound uses high frequency sound waves to create image of the structures inside the body. So unlike the X-ray and the CT, it doesn't use the ionizing radiation, and it's much more safer. Okay, so important thing to note while coding the ultrasound codes is that one important distinction that you will find throughout, whether the examination is complete or limited. Okay, so in ultrasound codes or under ultrasound section, you will find many codes like complete exam, limited exam. So what is a complete exam means? So complete exam means that the provider evaluates all the required structures for that particular anatomical region. So the complete code should be reported only if the report has each of these elements documented. So for example, if the complete abdominal ultrasound is performed, you should report the complete abdominal ultrasound code only when all the structures required by CPT guidelines for that complete abdominal study is performed. Okay, so I will show you a few examples going forward in the upcoming slides, so you will get much more clarity. So what if one of those structures cannot be seen? So in such cases, if the provider document the reason for which that particular structure was not examined, maybe it is because it was surgically absent, right? Some of the structures will be surgically removed, or when the reason will be like it is due to obscured bowel due to gas, or obscured bowel gas, that is due to which a structure is not properly visible. So if there is such documentation, it would be still considered as a complete examination. And a limited examination code will be reported when than fewer elements are observed, or fewer than the required complete elements are documented. Okay, and another important guideline, to not report a limited exam for the same anatomic region in the same session when a complete exam is also reported. So let's move on and I will show you how these codes are. Now here we can see briefly the ultrasound codings for the region of head and neck. You have all those codes from 76506 to 76536. I'm not going in detail to them. And when you reach the chest over here in the right side, you will find that two codes, 76641 and 76642. They are both coding for ultrasound of the breast, right? It can be unilateral or bilateral. And 76641 is coding for a complete chest, complete breast scan. And 76642 is coding for a limited breast scan or breast ultrasound. So I will show you what's the difference between a complete and limited here is. So the top you can see the guidelines that has been mentioned over here. 76641 represent complete ultrasound examination of the breast, and it would be considered as a complete when 76641 consists of ultrasound examination of all four quadrants of the breast and retroareolar region, also includes ultrasound examination of the axilla if performed. So if you have all these structure in your report, that's when you code 76641. And if any of these structures are not present, you can code for a limited ultrasound, which is 76642, unless the reason for not evaluating is mentioned in the x-ray report. Okay, so 76642 is much more focused ultrasound, or it will be focused on only some particular quadrants of the breast. All right, let me know, coders. Did this explanation help? Are you clear about what a complete exam and a limited exam is? Type in the chat. Okay, because going forward also you will see a lot of such code. So I will just tell this is a complete, this is limited, and you can find those detailed structures which make them complete in the CPT description. All right. Okay. All right. Thank you, Sefer. How about rest of you coders? Let me know. Okay. All right. Thank you. Thank you for letting me know. And let's move on. Okay. Next we have the abdomen and retroperitoneal code. And here also you will find two codes for ultrasound of abdomen. One is complete and one is limited. Okay, and in the top over here you will find what makes an ultrasound report complete, and what makes it limited. So for abdomen complete you need liver, the reports which mention the scan of liver, gallbladder, common bile duct, pancreas, spleen, kidneys, upper abdominal aorta, and inferior vena cava. So when all these structures are scanned and mentioned and interpreted, that's when you code complete abdominal ultrasound. Or if there is only single or a quadrant or a follow-up of a structure done, then you will code a limited ultrasound abdomen. Similarly, we have such classification or such distinction between the the ultrasound of retroperitoneal. You have a complete code as well as a limited code. And over here also again the structure requirement is mentioned by in the CPT manual as well. Okay, so when you get such scenarios, go ahead and look whether the documentation meets the requirement for a complete code. If it doesn't meet, you can code for a limited one. All right, so next, let's move on to another important section of your ultrasound coding, that is obstetrical section. And these codes are mainly classified based on three things. One, the gestational age of the patient. Two, the purpose of examination and how detailed the study is. Okay, so you can see 76801 and 76802 that are coded for or that are used for routine first trimester examination of the fetal and mother. You can see fetal and maternal evaluation, and this should be used only for the first trimester, which is less than 14 weeks. Okay, 76802 is used for each additional gestation. And then we have 76805 to 810, that is coded for a routine examination after the first trimester, or otherwise second trimester, equal to or greater than 14 weeks. That's when the second trimester begins. And this also includes fetal and maternal evaluation. Once again, 76810 is used for additional gestation. If there is a twin baby, that's when you use 76810. And then we have 76811 and 812. And here is an interesting point to note. So 76811 and 812 is coding for a fetal and maternal evaluation plus, that's what makes it different from other codes, plus detailed fetal anatomic examination. All right. So there will be more additional fetal anatomic examination that will be done. And there is also mention of what those structures are over here. You can see it's all clearly mentioned. It involves like fetal, the baby's chest anatomy, the abdominal organ, the spine, all those things will be examined in detail. And next we have 76813 and 814, that is used for a knuckle transfluency measurement. And we have 76815, which is used for a quick look examination, otherwise a limited examination when only one or two structures are only examined. Okay. And next, what are we? And another important point with 76815 is that it codes for both one or more fetus. Okay, so no need for another CPT code. So if there is a twin baby also, you have to code only once, that is 76815 one time. And finally, we have 76816 and 76817. 816 is used for a follow-up examination or when a re-evaluation is required because the previous examination showed some abnormalities. So in such cases, we use 76816, and 76817 is used for transvaginal ultrasound of pregnant uterus. So all the other methods were transabdominal. If you carefully look into the code language, only one code that is for transvaginal is 76817. All right. So let's move on. Then we have few additional codes for fetal biophysical profiles. So I'm just moving on to the next slide. And also in ultrasound section, we have codes for non-obstetric codes as well. Okay, thank you, Safir, for letting us know that. Thank you so much. So these are the non-obstetrical ultrasound codes. Okay, and here also you have a distinction between the ultrasound pelvic complete and limited. So pelvic examination will be done both on males and females. So you have different requirements mentioned at the top of the section over here. Okay, what are the requirements for complete male evaluation, and what are the requirements for complete female evaluation? Okay, so since we're running out of time, I am moving at a little bit more pace, and don't worry, the playback is always available. And then we have extremities code as well, which is again a complete and limited codes, 76681 and 82, and the structures that is required to be viewed for it to be complete is also mentioned here. All right. Okay, so I think it's time for another exercise. Here we go, coders. Of the following answers, which best describe the procedure? Option A 76700, option B 76705, option C 76770, option D 76775. A 54-year-old female presents to the outpatient radiology clinic for abdominal ultrasound due to history of elevated liver function test and persistent right upper quadrant pain. Radiology Center owns the ultrasound equipment and the radiologist is employed by the center. The radiologist performs real-time scan and archiving permanently recorded image and measurements. The final return reports details normal finding for the liver, gallbladder, common bile duct, pancreas, spleen, and upper abdominal aorta. Of the following answers, which best describe the procedure? Coders, you got 2.5 minutes to answer. Go ahead, place your answer in the chat. All right, Coders. So I will stop the timer because I want you to do a few more scenarios from this section. So I'll just stop the timer. Please, as I said, please feel free to watch the playback. Okay. So great answer so far. Excellent participation in the chat. So that's matters. The participation is what matters the most. And here we have four codes: 76700 and 76705 is for ultrasound of the abdomen. 76770 and 76775 is ultrasound for retroperitoneal. We had ultrasound of abdomen that was performed. And as you see, one code is for complete, one is for limited. Okay, so if you remember what I said in the beginning, how to differentiate between complete and limited, you have to go and check for those structures mentioned in your CPT book. Okay, whether it's been met or not. So we had here a ultrasound of the abdomen. So to code them as a complete, you require a scan and documentation of liver, gallbladder, common bile duct. Then we have pancreas, spleen, kidneys, and upper abdominal aorta, as well as inferior vena cava. Okay, and all these should be mentioned to build it as a 76700, which will be a complete ultrasound abdomen. And my question is, did we have all the elements scanned or all the structures scanned? Or let me know, Chorus, which one was missing? Let me know which one was missing. Quickly, Chorus, type in the chat which structure was missing. Okay, I'm just waiting for your answers. There you go. Great. Yes. Mr. Starisani was one of the first coders to answer, and yes, what you mentioned is absolutely right. You don't have the documentation of the kidneys or the IVC, which is inferior vena cava, right? There you go. Yes, Becky. Yes, Miss Safir. Yes, you all are perfect. Great forensic coding. And that's the reason why we would assign 76705 as a correct one for this scenario. Excellent job. Okay, let me quickly move on to the next one. Here we go, coders. So I will start the timer because we are almost there. I want you to do a couple more scenarios if possible of the following answer which best describe the procedure. 76801, 76802, 76805, 76805, 76810. Option D, 76811, 76812. A 31-year-old female at 18 weeks gestation present for a scheduled transabdominal obstetric ultrasound of a non-twin pregnancy. The radiologist performs complete maternal and fetal evaluation of the both fetus, documenting all the required anatomic surveys, amniotic fluid assessment, and placenta location. Of the following answers, which best describe correct CPT code? Okay, that is time. So let's quickly solve this one, coders. And here we have a patient presents for transabdominal ultrasound of the obstetric ultrasound of the twin pregnancy, and we had a maternal and fetal evaluation performed for both gestations, right? So option D, 76811 and 812, I would say it would be incorrect because if you read the code language, it's for a ultrasound pregnant real time with image documentation of fetal and maternal evaluation. So it doesn't stop there. Plus, it requires a detailed fetal anatomic examinations. Okay, so if you remember, I showed you some requirements for the document recommendation for 76811, and it requires much more detailed rather than the regular fetal examination. It requires a detailed fetal anatomic examination. Okay, and that's why it's missing here. The language is missing here. That's why I would say option D would be the wrong one. And 76805, option C, is also incorrect because that's only coding for a single gestation. We will review the CPT code. 76805 is for ultrasound, pregnant, real time with image documentation. You see, it's for fetal and maternal evaluation after the first trimester, single gestation. So it looks like good, we had a second trimester, right? So 18 weeks would be considered as a second trimester because first trimester is less than 14. Okay, so and I think we need one more code because it was a twin pregnancy. So for the additional gestation, I would say 76810 would be also given. And option A is incorrect because that's coding for ultrasound pregnant real time with image documentation of fetal and maternal evaluation first trimester. So this way beyond first trimester, it's the second trimester, and that makes option A incorrect. Correct answer is going to be option C, 76805 and 810. All right, I can see. Okay, great. Great answers in the chat. Yes, please do let us know if the explanation helped. I think we can do one more scenario. I don't want you all to miss out this one. Okay, let's do one more scenario, and we will quickly wrap it up with other sections. Okay, so here we go. I will start the timer of the following answers which best describe the procedure. Option A, 76830 76817. Option C, 76805 76801. A 24-year-old female at 8 weeks gestation presents to the emergency department with vaginal bleeding. The physician performs diagnostic real-time vaginal ultrasound to evaluate pregnant uterus to check the viability. Permanent recorded images and written interpretations are documented in the medical record of the following answer, which best describe the procedure. All right, that's time, and I can see only one alphabet, B, for brilliant. Great job. So, coders, quickly, let me walk you through this one. So, here we have a patient presence for an ultrasound. An ultrasound. This was a patient presenting to the emergency department with vaginal bleeding, and a transvaginal ultrasound of the pregnant uterus was performed, right? So, if you carefully look into the all the CPT options, all are coding for trans-abdominal ultrasound, right? I mean, option B, C, and D are definitely coding for trans-abdominal ultrasound, and they are incorrect because we had a trans-vaginal ultrasound in our scenario, right? So that makes option C and D incorrect. Between option A and B, option A is coding for also it's also coding for a transvaginal ultrasound. And you know why it's incorrect? Because that's for a non-obstetric ultrasound, transvaginal ultrasound. So if you had an obstetric transvaginal ultrasound, you should use 76817, And that's why option B is right. B for brilliant. You all did an amazing job, coders. Great, great, great coding. So quickly, I will walk you through few more sections. So these are pretty much straightforward. So I won't spend much time. You can go through them easily. So next section would be the radiological guidance section. As I said in the beginning, you have the supervision interpretation as well as guidance guideline. So when a procedure or whenever the terminology or the language of the procedure indicates that the guidance is included, then you will not report these codes. Okay, the guidance code. When it's not mentioned, yes, you can assign the guidance code. Also, be mindful about the parenthetical guideline. Okay, parenthetical guideline will really guide you to know whether or not to use these guidelines, I mean these radiological guidance codes or not. And here also you can see under a lot of CPT codes, do not report 76940 in conjunction with all the surgery codes, which means they should not be reported. I haven't reviewed those codes individually, so most probably they must be included in the code language itself. So that's might be the reason why you should not code them. So always pay attention to the parenthetical code, and that will really help you to decide whether or not to use these guidance code. So we have ultrasound guidance procedure codes, we have fluoroscopy guidance procedure code, CT guidance code, and MRI guidance code as well. And finally, this was the final topic which I thought I will discuss, but I will go briefly through them. You have the breast mammography CPT codes. Now, important thing you have to remember here is what's a diagnostic procedure and what's a screening procedure, because over here you will find these two terminologies, screening mammography and diagnostic mammography. So coders, screening mammography is when patient is coming with no symptoms. Okay, patient doesn't have any symptoms, it would be an annual screening program or annual screening ultrasound. While in diagnostic mammography or diagnostic conditions, that's when patient is coming with a complaint like a breast pain or feeling a mass in the breast or something like that. That's when you will assign the codes from the diagnostic section. All right, is that clear, coders? Let me know quickly, let me know in the chat. Is that clear when to use the diagnostic code and the screening code? Actually, I had one scenario for you all from that domain, but since we are almost the time, we have crossed the nine, we have crossed the time. Okay, so I'm not going to do that exercise. Maybe next semester when we do radiology section, we will do that scenario. All right. So how did you all do, coders? Was this session helpful? Let me know in the chat. And if you feel like you need more practice, I always say, don't worry, mastery doesn't happen in one session. It happens with consistent learning and repetition and the right support. So if you feel like you need to watch the playback, or if you need much more practice such scenarios, such guideline scenarios, you can always visit our AMCI channel and you'll find the topics which we cover on these Fridays, the CPT guideline mastery sessions, under the playlist named CPT guideline mastery. So you will find all list of the topics which we have already covered. And as I said, please do fill out the survey form. I can see a lot of students are in the chat participating. Please kindly, I request you all to take a moment to fill that survey form and let us know how you felt about the session. Did this help you? Which topic, which part helped you more? If you have any doubt also, you can mention them. And also, coders, next Friday we will be back with another topic that would be based on a medicine, that would be from medicine or path and lab section. If you have any topics in mind that we have not covered yet, please do mention them in the survey form as well, and I will definitely select one topic from what you are suggesting. All right, so you can mention them as well. Please do take a moment. It will take less than 1 minute. That's all we ask. All right. So, with that, we come to a conclusion of this week's CPT Guideline Mastery session. If you really enjoy this video, don't forget to smash that like button, subscribe to AMCI channel. We have a lot of things happening in our channel throughout each throughout the year. Okay, so subscribe and hit that bell icon so that you will get the notification. Also, share it with someone who really needs to see this lecture videos. All right, so we'll see next Friday. Till then, stay safe and keep coding, coders. Okay, so once again, please do fill out the survey form. Thank you, Miss Mills, and thank you, Miss Catherine, for being there in the chat, supporting me and the coders. Thank you, coders. See you all next week with a new topic. Till then, as I said, stay safe, keep coding, have a rest, have a great rest of the day.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all